Hey everyone, I just wanted to go over the week 6 assignments. Here you will see the required readings and videos for the week. You have 2 chapters in the Cooper book, which describe cognitive theory and behavior theory. I'm sure you are all aware of the evidence base for CBT and DBT. Within these chapters, I'm hoping you can gain a thorough understanding of the basis for the interventions. CBT and DBT are very skills-based approaches. Even if you do not use them as a standalone approach for treatment, you will find that the strategies within these theoretical approaches can be very useful in promoting change. Something that I know I utilize often in treatment is recognition of core beliefs or schemas, which you will read about in the Cooper book. I often utilize the testing automatic thoughts approach to gradually chip away at some of the negative core beliefs or schemas. I find this to be helpful with both children and adults, as it can really help them to gain insight as well as provide them with a practical tool. Of course, if you're working with children, you really adapt some of those approaches to an age-appropriate level. And there are plenty of creative ways that you can do this. But yeah, I mean, it can be really empowering for them to understand how they can have impact towards their change. As you will see within the readings and videos, homework is a common occurrence within CBT and DBT as well. Personally, I find this is something that can be utilized very well with certain populations, but not all populations. It's also important to provide homework that is achievable for the client. For instance, if you're seeing a client with limited literacy, you would not want to give them an assignment that would include writing. That might seem self-explanatory, but there's a lot of approaches within CBT that require things like completing a thought record or diary, as well as in DBT, there's something called a diary card that might help them to acknowledge their impulses, and address the way that they're coping with them. And that wouldn't be something clearly that you would use for somebody with literacy issues. In addition, if you're seeing someone who is severely depressed, you might want to provide homework that is more achievable, like such as you will take a shower 2 times this week. Kind of look at where they are in their functioning level and assign homework accordingly. You would never want to be seeing somebody that's severely depressed and say, okay, I want you to do a thought record 3 times every day this week, or I want you to practice progressive relaxation 2 times a day, because they're already having so many struggles with even just daily functioning. So you really want to make sure that any of those homework or behavioral assignments or cognitive assignments are really geared towards where they are. So moving on, the remainder of the reading, you have a few articles here to choose from. You are only required to read 2, and again, it could be helpful to read an article that might relate to the client you're writing for the paper. Just, especially with a theoretical concepts paper, you're going to be required to have 10 sources. So here you might find some that might be useful for that. Depending on the issue, some of them might not relate to the client that you did for the developmental assessment paper. And then below you have 3 videos to watch. The videos are really the core of what you'll be using for the discussion this week. You'll see they are a little lengthy, but the required segments are listed here. As you can see, 2 of the videos are regarding dialectical behavior therapy. As I'm sure you know, DBT is a useful approach for people with borderline personality disorder, and just to kind of give a little bit more explanation of this kind of treatment, again, it is very skills-based, which is slightly different than the approaches that we have learned about so far in this class. DBT includes both a skills group and individual therapy, with the ability for the client to be able to reach the therapist 24/7. As many of those who receive DBT treatment have active suicidal ideation and self-harming behaviors, it's important that they do have that 24/7 access to their therapists. The treatment is very intensive and focuses on mindfulness, emotion regulation, interpersonal effectiveness, and distress tolerance. So I'm hoping that you can gain a thorough understanding of DBT through these videos. I have had training in DBT, and I have conducted a DBT skills group as well as individual DBT therapy while I was at a previous job that I'm at for my full-time job now. I found the skills to be very effective if you're able to appropriately engage and motivate the client or the clients in treatment. Individuals with borderline personality disorder and chronic suicidal ideation are notorious for being very difficult to work with, and it really requires towing the line between acceptance and work towards change, which is the core part of this approach, being dialectical. In addition, it's important to recognize countertransference with this population. During my time providing DBT, I utilize supervision often, as inevitably I experienced emotions related to some of the transference that they were enacting during my time that I would work with that population. So just a couple of things to keep in mind, and you might find some of those things that I've already mentioned within these videos or the readings. So moving on to the discussion for the week, your assignment is to choose one of the videos and describe what you have learned about interventions with clients in the videos. So for this portion of your post, you will describe specific things you have learned that were referenced in the video, such as specific skills or basis for the use in treatment. The second portion of the post will be why you think it will inform your practice. So here you might talk about either how and why it feels like a good fit for you as a clinician, how it might be a good fit for a population you plan to work with, or even just how it has allowed you to become more diverse in your understanding of clinical work. You can also discuss specific ways you might now be able to implement this into your practice. Here you can feel free to reference a former client or a current client if that helps you to explain a little bit better. Just make sure to protect identifying information as usual. And for this initial post, it is due Thursday at 11:59 p.m. So for your response post, you are just going to be providing feedback to somebody. Here you can discuss similarities and differences in your understanding, discuss how their post helped you to better understand something, or even write something that might further their understanding. You can either respond to someone who chose the same video as you or someone who chose a different one, but the response posts are due by Sunday at 11:59 p.m. And as usual, please be sure to provide citations, especially for the video, so that we are all aware of which video you chose. In addition to the discussion, please remember that the theoretical concepts paper is due on Sunday at 11:59 as well. And I hope everyone has a great week. Reach out with any questions.